Hi everyone! Today we're tackling a topic that's incredibly important to me as a mental health professional, ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is often misunderstood, leading to harmful stereotypes and misconceptions. We're here to set the record straight. Throughout this video, we'll be debunking some of the most common myths surrounding ADHD, shedding light on the science behind it, and exploring how we can foster a more compassionate and supportive environment for those who live with it. So if you're ready to challenge your assumptions and gain a deeper understanding of ADHD, stick around. Let's get started. Okay, let's jump right in with a major misconception. That ADHD is all about hyperactivity, kids bouncing off the walls. This is a common stereotype that many people hold, but it's far from the complete picture. ADHD, or Attention Deficit Hyperactivity Disorder, is often misunderstood and oversimplified. When people think of ADHD, they usually imagine a child who can't sit still, is constantly moving, and is always getting into trouble. But there's so much more to it than just hyperactivity. While hyperactivity is a common symptom, it's not the whole story. Many individuals with ADHD can actually be quite calm and focused, especially when they are engaged in activities they enjoy. It's important to recognize that ADHD manifests in various ways, and not everyone with the disorder will exhibit the same behaviors. ADHD is actually a complex neurodevelopmental disorder that affects attention, focus, and impulse control. It's not just about being hyperactive. It's about having difficulty maintaining attention and controlling impulses. This can impact many areas of life, from academic performance to social interactions, and even daily tasks. And get this, there are actually 3 subtypes of ADHD: predominantly inattentive, predominantly hyperactive impulsive, and combined type. Each subtype has its own set of characteristics and challenges. Understanding these subtypes is crucial for providing the right support and interventions. The inattentive type often gets overlooked, especially in adults and women, because the symptoms are less disruptive. People with this subtype may appear to be daydreaming or simply not paying attention. They might struggle with organization, forgetfulness, and following through on tasks. These symptoms can be mistaken for laziness or lack of effort, but they are actually signs of ADHD. Think difficulty focusing, getting easily distracted, struggling to follow through on tasks. It's not always obvious to others. These individuals might have a hard time starting or completing projects, and they can become overwhelmed by the demands of daily life. It's a constant battle to stay on track and manage their responsibilities. Now, for those with the hyperactive impulsive type, you might see more fidgeting, restlessness, and difficulty sitting still. These individuals are often described as being on the go or driven by a motor. They may have trouble waiting their turn, interrupt others, and act without thinking. This can lead to challenges in social situations, and can be particularly disruptive in structured environments like classrooms or workplaces. They might blurt out answers, interrupt conversations, or have trouble waiting their turn. This impulsivity can lead to misunderstandings and conflicts with others. It's not that they don't understand social norms, it's that their brains are wired differently, making it harder for them to control their impulses. And finally, the combined type, as the name suggests, is a mix of both inattentive and hyperactive impulsive symptoms. These individuals experience the challenges of both subtypes, which can make daily life even more complicated. They might struggle with focus and organization while also dealing with restlessness and impulsivity. It's important to remember that ADHD presents differently in everyone. No two people with ADHD are exactly alike, and their experiences can vary widely. Some might excel in certain areas while struggling in others. This diversity in presentation means that a one-size-fits-all approach to treatment and support simply doesn't work. There's no one-size-fits-all picture, and understanding these subtypes is crucial for accurate diagnosis and support. By recognizing the different ways ADHD can manifest, we can better support those who live with it and help them thrive in their unique ways. Whether it's through medication, therapy, or lifestyle changes, tailored interventions can make a significant difference in managing ADHD symptoms and improving quality of life. Another misconception we need to debunk is that ADHD is just a kid's thing. While it's typically diagnosed in childhood, ADHD doesn't magically disappear when you turn 18. In fact, studies show that a significant percentage of individuals diagnosed with ADHD in childhood continue to experience symptoms in adulthood. Now, how ADHD manifests in adults can be different from what you see in children. Sure, some adults still struggle with hyperactivity, but for many, it's more about internal restlessness, difficulty with time management, and challenges in relationships or at work. Imagine struggling to meet deadlines, feeling overwhelmed by everyday tasks, or having trouble maintaining focus in meetings. These are just a few examples of how ADHD can impact adults. It's crucial to recognize that ADHD is not something people simply grow out of. It's a lifelong condition that requires ongoing management and support. This next misconception is one that really gets under my skin. The idea that ADHD is just an excuse for laziness or bad behavior. It's a frustrating and damaging myth that undermines the real struggles faced by those with ADHD. Let me be crystal clear. ADHD is a real neurological condition. It's not something that people can just snap out of or get over with sheer willpower. The brain of someone with ADHD functions differently, and this has been proven through extensive research and brain imaging studies. It's not a choice, a character flaw, or a lack of willpower. People with ADHD often have to work much harder to achieve the same level of focus and productivity as those without the condition. This isn't because they're lazy or unmotivated, it's because their brains are wired differently. Brain imaging studies have shown that the brains of people with ADHD differ structurally and functionally from those without the disorder. These differences can affect various aspects of their lives, from academic performance to social interactions and even daily tasks. Specifically, areas of the brain involved in attention, impulse control, and executive function. Think planning, organization, and decision-making tend to be less active or develop differently. This means that tasks that require sustained attention, organization, and impulse control can be significantly more challenging for someone with ADHD. So, when someone with ADHD struggles to focus, complete tasks, or control their impulses, it's not because they're not trying hard enough. In fact, many people with ADHD put in a tremendous amount of effort just to keep up with everyday demands. Their struggles are real and valid, and they deserve understanding and support. Their brain is literally wired differently, making it significantly more challenging for them to perform these functions. This isn't a matter of choice or effort. It's a matter of neurological differences that require appropriate strategies and interventions to manage effectively. Dismissing their struggles as laziness or bad behavior is not only insensitive, but also incredibly harmful. It can lead to feelings of shame, low self-esteem, and even depression. People with ADHD need support and understanding, not judgment and criticism. It's essential to approach ADHD with empathy, understanding, and a recognition that it's a genuine neurological condition. By educating ourselves and others about the realities of ADHD, we can help create a more supportive and inclusive environment for those who live with this condition every day. Now, let's address the flip side of the coin, the misconception that ADHD is overdiagnosed. While it's true that ADHD diagnoses have increased in recent years, this doesn't necessarily mean it's being overdiagnosed. In reality, there's a good chance we're actually underdiagnosing ADHD, especially in certain populations. You see, access to mental health care, cultural biases, and a lack of awareness among healthcare providers can all contribute to underdiagnosis. For instance, women and girls with ADHD are often overlooked because their symptoms might present differently than those typically seen in boys. They might be more likely to internalize their struggles, leading to anxiety or depression rather than outward hyperactivity. Additionally, cultural factors can play a role. Some communities may stigmatize mental health conditions, making individuals less likely to seek help or receive an accurate diagnosis. It's crucial to remember that ADHD is not a one-size-fits-all diagnosis, and we need to be mindful of the systemic barriers that prevent individuals from receiving the care they need. Let's talk treatment. When it comes to managing ADHD, there are many misconceptions that can cloud our understanding of the best approaches. One of the most pervasive myths is that medication is the only way to manage ADHD effectively. One final misconception I want to debunk is that medication is the only way to manage ADHD. While medication can be incredibly effective for many individuals, it's not the only option. In fact, relying solely on medication can sometimes overlook other valuable strategies that can be just as impactful. While medication can be incredibly effective for many individuals, it's not the only option. A comprehensive approach to ADHD treatment often involves a combination of strategies tailored to the individual's needs. This means looking beyond just pills and considering a variety of therapeutic and lifestyle changes. A comprehensive approach to ADHD treatment often involves a combination of strategies tailored to the individual's needs. For instance, behavioral therapy can be incredibly beneficial. This type of therapy focuses on modifying specific behaviors and developing skills to manage symptoms more effectively. Behavioral therapy, for example, can be incredibly beneficial. It helps individuals understand the connection between their thoughts, feelings, and behaviors, and teaches them practical skills to navigate daily challenges. Cognitive behavioral therapy, or CBT, can help individuals develop coping mechanisms, improve time management skills, and challenge negative thought patterns. CBT is particularly effective because it provides tools that can be used long after the therapy sessions have ended. Other therapies, like social skills training or parent management training, can also provide valuable support. Social skills training helps individuals improve their interactions with others, which can be a significant challenge for those with ADHD. Lifestyle modifications can also make a big difference. Regular exercise, a healthy diet, and consistent sleep can all positively impact ADHD symptoms. Exercise, for instance, can help reduce hyperactivity and improve concentration. Regular exercise, a healthy diet, and consistent sleep can all positively impact ADHD symptoms. Eating a balanced diet rich in nutrients supports brain health, while good sleep hygiene ensures the brain gets the rest it needs to function optimally. Additionally, creating a structured environment, breaking down tasks into smaller steps, and using visual aids can improve focus and organization. These strategies help manage the chaos that can often accompany ADHD, making daily tasks more manageable. Remember, ADHD is a lifelong journey, and finding the right treatment plan is a process of trial and error. It's important to be patient and open to trying different approaches until you find what works best for you. It's about working closely with healthcare professionals, exploring different options, and finding what works best for you or your loved one. With the right combination of treatments and strategies, managing ADHD is not only possible, but can lead to a fulfilling and productive life. That's it for today's video. I hope this has helped clear up some of the confusion surrounding ADHD and challenged any preconceived notions you might have had. Remember, knowledge is power, and understanding ADHD is the first step toward creating a more compassionate and supportive world for those who live with it every day. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and hit that subscribe button so you don't miss out on future videos. And as always, if you have any questions or topics you'd like me to cover in future videos, leave them in the comments below. Thanks for watching, and remember, you're not alone on this journey. Until next time, stay informed, stay curious, and most importantly, stay healthy.